Okay, hello everyone. Welcome to Youth Assembly. My name is Sylvia Ishebe, and it feels so good to be here again for another interesting edition of Youth Assembly. Well, today we'll be looking at how prepared Nigeria is to prevent a second wave of coronavirus. Now, some countries like the Britain and France are experiencing a second wave of the coronavirus. In Nigeria, the Presidential Task Force on COVID-19 and the presidency have warned that Nigeria could experience a second wave of coronavirus if adequate steps are not taken to prevent a rise in cases of the virus. So, what must Nigerians do to prevent a second wave of the coronavirus from hitting the country? Now, that is our focus on today's edition of Youth Assembly as we look at how prepared Nigeria is to prevent the second wave of coronavirus. I have with me today Dr. Aderiola Alaolu. Welcome, Doctor.
Thank you for having me.
Well, Doctor is the incident manager of the National COVID-19 Emergency Operations Center of the NCDC. Good to have you here. I also have with me Ale Odiame Ayodele. He is a public health practitioner. Welcome, Mr. Ale.
Thank you. Good morning.
Okay. So, do you think a second wave of coronavirus is likely to happen in Nigeria with the imminent full reopening of the Nigerian economy and what we see happening in the society? Doctor.
Okay, thank you. Having a second wave in the country is dependent on how well we all abide by the guidelines to ensure that we reduce the spread in the country. So we've had a lockdown in the past, and the economy has opened, and this can be done safely, in which we can prevent the transmission of the disease. So if we all abide by the guidelines, physical distancing, ensuring everyone wears a mask, we can really reduce this and not have a second wave. But with the current situation in the country, which so many people are no longer wearing masks, I hear some people say in the days of COVID, as if we're already out of the woods. We are not yet out of the woods. The virus is still with us. It's human beings that that move the virus around. So the virus just doesn't fly. It's droplets, and if you don't use mask, you have those droplets on surfaces. If people touch it and they are not washing their hands, they can now have it. So all these measures need to be done, and with the leadership from the PTF, a lot of actions have been taken to ensure that the country reopens safely so that we can still have our life and livelihoods and reduce reduce the transmission to a very significant level. So if we all abide by this, the people, government, partners, agencies, institutions, then we will be able to reduce this. But if we don't, so it's a collective thing. We are strong as the weakest point uh, in the country. So we need everybody's hand on board so that we can reduce infection and prevent a second wave. So it depends
Okay.
on what we can really take.
Okay. Speaking about having everybody's hands on deck in order to prevent a second wave, Ale Odiame, let's hear from you. What do you think? Do you think Nigeria is prepared and Nigerians are prepared, Nigeria as a whole, prepared for another wave of the coronavirus infections?
Well, in order for a second wave to come, the first wave has to be gone. So, presently, I think Nigeria is still experiencing its first wave because the
First,
first wave has to, yeah, because the first wave has to be over first, and that means the number of COVID-19 infections have to reach a very like single digits before we can say we are moving on. So it is when there are new infections, maybe from people coming in through international flights and all, that's when we now have a second wave. So as it is right now, I would really say that Nigerians have become a bit complacent. People are no more wearing their face masks. People are not practicing social distancing and all. And if this continues at this rate, the cases will still multiply. As at yesterday, the number of cases we had in Nigeria, from as released by the NCDC, was about 152. cutting across the FCT, Lagos, and some other states in the country. So this shows that the infections are still going on, and because people are not practicing social distancing, are not wearing their face masks, and the fact that the economy has to reopen too, so schools are coming back, and even international flights are being allowed. So this is making it very hard for even the first wave to go away.
Okay, would you say there is a rise in infection as at now with the figures we have coming from the NCDC? Doctor, would like to hear from you. Is there a rise or a spike in the rate of infection, or we still have uh, um, what is obtainable in times past?
Okay, so for us, I can say we have a spike. This has to do with the number of tests that we have done. It's when we test sufficiently, that's when we can really say confidently that we have a spike or we don't have. Currently in the country, and not just Nigeria, but the African continent, the case fatality has not been that high as we have in developed countries. But we know that developed countries, they have the capacity to test much more than we are, and people are willing to also get tested. So that is one aspect of it. The other interesting thing about COVID-19 is that we have a high number of persons who are asymptomatic. That means they will never show the symptoms but can transmit it to others. And we have some that may just have mild symptoms and may just wave it away. They just feel, no, this is malaria. I don't want to go to any health facility. I'll just treat myself, because the symptoms will also come like malaria, and some maybe just have weakness. Some may have loss of smell and taste, and so those are indications for people to come to a health facility so that their samples are collected. And several states have opened sample collection sites to get tested. So with this, we may just be having undetected cases, and since it's a youth platform, we know that the severity is actually higher among the older persons, 50 years and above, and those who have comorbidities, hypertension, diabetes, or other issues like cancer. It's something that makes the immune system suppressed. So I think the message is for everyone, especially youth. They shouldn't feel well, even if I have it, it shouldn't do anything, but they can transmit it to others. And the more reason that everyone needs to wear a mask. You are not just protecting yourself, you're also protecting your loved ones and breaking this chain of transmission. So
Okay. Speaking of testing, what are some of the challenges you face so far around testing in Nigeria, and how do you think it can be overcome?
okay, so for testing, I think the first thing is to provide access, have testing laboratories, testing sites. When this outbreak occurred, we just had about three or four laboratories. Now we have laboratories across the whole country, more than 70 testing sites and counting, with partnership from the private sector. We have private laboratories now also testing. So the access is there. So, but it's for people to now come in when they have symptoms. They should call their state contact lines so that their samples can be collected. And also, I think we had issues of stigma. I think one of the cases, the issues we are now having is that those who even come down positive are not willing to even tell us the contacts where they have been, so that we can now test those persons. So those are the issues. But with the way things are, is dynamic, states are leading this response in their states, and with the capacity of testing, we just need to ensure that we are testing every day based on the case definition we have, and also the index of suspicion, to ensure that everyone gets tested. So that is one thing we are really working on. So we expect the Nigerians to also be tested. I think this the stigma has to really be out, and people should really believe that there is COVID. It's not just an elitist disease; it's a disease occurring over the world. That's what we need. So we need people to believe that COVID is indeed real, and once they get tested, that's when they know their status and can protect other persons.
Okay, let's hear from you, Mr. Ali. What do you think is responsible for this misconception of people believing that COVID is over and we don't have COVID anymore? With this second wave imminent, if people don't do the right thing, well, how can they be educated to prevent the wave from happening again?
Okay, well, a lot of people getting these misconceptions because, for example, in some states like Zamfara State, the government is saying that they do not have the virus anymore. And once you tell people that the virus is out, because they believe the government as a credible source, they will take that and throw caution to the wind, not wear their face mask, not practice social distancing. So we need to be careful about the information we turn out to people and let them know that this is actually a virus and doesn't just go away like that. They need to adhere to the safety protocols. They need to wear their face masks. They need to practice social distancing. Regular hand washing is important. And with the reopening of the economy, it's also important that wherever people are going to be gathered, these protocols are strictly adhered to. For example, in schools, there's nothing wrong from making children, even as low as in pre-nursery schools and nursery schools, to wear their face masks and ensure that they do, because these kids have little attention span and might try playing with all this with the face mask. But make sure that they do, then show them the importance of regular hand washing. Then also IEC materials, information and education materials as to the importance of still keeping the tempo as regards and adhering to these safety protocols would make it easy for us not to transition into a second wave. So churning out information through the media, as we are doing right now, would also make it very possible for that to happen.
So, what lessons can Nigeria learn from other countries? I mean, the UK and also some other countries in the world are already experiencing the second wave and they're under lockdown. What do you think Nigerians can learn in order to prepare us from experiencing what other countries are experiencing? I mean, nobody wants to go back to that place where you just have to stay indoors for months. So, Doctor, tell us, what lessons can we learn?
Yeah, so the lessons that we learn here is that this response is a whole of society response. Uh, as government takes leadership, we need everyone to be part of this response to ensure that all the protocols we have about physical distancing is very important. Wearing of mask, regular hand washing is very important for us to be able to prevent a second wave. And one key lesson we should also bring out here is that this can really lock down the economy. And we know that our economy is not as strong as the developed countries. We know that we don't have sufficient reserves for palliatives and all that. And also noting that aside from COVID, we also have epidemic prone disease in the country. We have yellow fever, which is already coming up in some states. Lassa fever hasn't really gone, and we are beginning to enter the dry season. So these measures doesn't just help us in COVID alone, but also helps to prevent other diseases from spreading. So we need to ensure this is done at government level. PTF is leading very well. We have the good political leadership in the country. We see the steps taken at international flights, ensuring that anyone who wants to come into the country must have a negative COVID-19 test by PCR. And after the seventh day of coming into the country, another test is done while they are self-isolating at home. So these are measures to ensure that even when persons come, because the incubation period for COVID is between 2 to 14 days, there's a possibility of even those who have a negative test to be positive subsequently. And that's why they're tested after 7 days to ensure that we don't have an importation of new strains. As you know, the COVID itself is a zoonotic disease. It means that it's originated from animals but can now affect man. And when it also moves to another animal, then it can actually change, which is at least mutate and could be a more severe one. But I guess those are lessons we really need to learn. It's all of society. I think there is breakthrough with vaccine now coming on board. But even before the vaccine comes, there are ways that we can do to ensure that we distance ourselves, wear our mask, wash our hands regularly. And it's for Nigerians to see that we really enforce this. We should be our, our, our neighbor's keeper, and any institution that can enforce should we more or less use moral persuasion. We need people to really understand. This is not a period where you can just be arresting people, because where will you keep them if you want to still have physical distancing? So we need everybody to really take responsibility for this. We need to grow this country. We need to grow this economy. We need the jobs for everybody to be fully engaged, and this needs to be done safely, so that we don't jeopardize our lives. We don't lose time due to illness, and we don't lose our loved ones.
All right. If you are just tuning in, it is Click Niger. Youth Assembly is the show. And we have been talking, excuse me, we've been talking about how prepared Nigeria is for to prevent a second wave of the coronavirus. And with me, I have Dr. Aderiola Alolu, who is the incident manager of the National COVID-19 Emergency Operations Center, NCDC, and also Ale Adiame Ayodele, a public health practitioner. So the question I felt there is how what must Nigeria do to prevent a second wave of coronavirus from hitting the country? You can drop your comments, and if you have questions, we have health practitioners here who will be able to answer that. So feel free to drop your comments and also share and like the video. All right, Mr. Ale, back to you.
Okay.
So what must the government do, or what must they do differently from what they're already doing to prevent a second wave from happening?
Okay. Well, I think in order for us to prevent a second wave, first we need to intensify on testing. I think as at the time of these when we had the Salah break, testing kind of reduced, and since then it has just kept on reducing and reducing across the nation. So it is important that we keep testing because this virus is still out there. It's just that we don't know how many people have it. So if we intensify testing, we would get to know how many people actually have it and treat them. So because we have to be done with the first wave before we can even decide, okay, we are in a second wave. Countries that have actually experienced the second wave is because they were actually able to test and bring down their number of new cases before they now realize that, okay, this is actually a second wave of the virus. So we need to intensify on testing. Then also, I think we need to impose stringent rules as regards the safety protocols, because once you are able to put these rules, people would know that they have to abide by it. But if you allow everybody to have a laissez-faire attitude to it, that they can do whatever they like, and they don't take responsibility for the fact that if they don't protect themselves, they're also not protecting the next person to them, then we would continue to have more cases.
Okay, thank you. Thank you so much. But we've seen people in marketplaces, restaurants are opening, people are eating in. So I would like to hear from the doctor. Is it safe for people to be going about businesses, especially for restaurants to be able to customers and they eat in and all that? Is it safe at this time?
Yes. So as you said, we can't lock down forever. The important thing is how can we open the economy safely, and part of this is ensuring that there are guidelines available. If and it's based on individuals really taking responsibility for their own lives to ensure that you protect yourself and your family. The guidelines are there to put people in place. I think one other aspect is that we also need to improve enforcement, and when you want to enforce, the agency the institution that can really enforce is the police. And I think we have a road safety call trying to enforce sitting arrangements in motor parks. But for restaurants, physical distancing is still very important. I think people should just order their food and take it away. Or if people really want to eat, that means physical distance has to be there, 2 meters apart, and that is important. Then for the restaurant owners, there should be constant cleaning of surfaces, places where people will touch. It should be done regularly because the virus is on surface and it can stay for days. So regular cleaning before customers enter into the restaurant, their temperatures need to be checked to ensure that they don't have fever. Uh, Hand washing stations need to be there, and not just there, for the institution owners to ensure that people really wash their hands under, under running water, and also provide hand sanitizers for people to actually get this. I think in some places you just see those facilities there, people just walk by it. It's also to enforce that, because if there's an outbreak within a facility, that facility will be closed down so that you do contact tracing and all that. And I think one other key thing is also for register to be to be opened as much as possible, because that will really help contact tracing for us to know who has had this. And not just restaurants, any place where you have people gathering in their numbers, everyone
Mhm.
should wear face mask. There should be physical distancing, temperature should be checked, and those are the things to ensure that we don't have overcrowding in various institutions. We know
All
that
right.
people need their livelihood, but this needs to be done safely.
Okay, so schools are back in session, and we've already seen cases of coronavirus reported in boarding schools and outbreak, and the school shutting down and isolating the students. Some students have also complained that in their schools, some persons don't wear masks for the whole period of time they have to be in school. People who have complained that it's so uncomfortable, or they can't really speak well when they wear their masks. So let me hear from you, Mr. Ali. What do you think about this mindset or this development in places such as schools, churches, and places where there are high number of people?
Yeah, it is very important to wear the mask, and while it might be uncomfortable because that is before coronavirus, that was not the norm. But since that is what can actually prevent people from getting the virus, people want to abide by it, because at the end of the day, we all want to be healthy, we all want to be safe. So we do not want to do something that will put ourselves or the lives of other people in danger. So wearing a mask is very, very important, especially when you are going to places where people are gathered. And also, the mask would not just would prevent the droplets from more droplets from getting from one person to another, and that is the way the virus is being transferred. So, in order for this virus not to be transferred among people, we need to enforce wearing the mask. It might not be comfortable, but right now, comfort is not what we are looking for. We are looking for people to be healthy. So, like we said, we need to learn how to live with the virus, and that is reopening schools, churches, and mosques, but still keeping with the safety guidelines. And as the doctor has clearly pointed out, these institutions also want to take the initiative to make sure that people are safe, ensure that people wash their hands regularly before going in and out of these places of worship or schools, and also ensure that people keep by the guideline of wearing their mask. Very important.
All right, Doctor, back to you. Same question, but for schools where students might not feel comfortable. In fact, I've seen where a teacher is telling the student, okay, if you can't read, just put it here. You know, what happens for children who can wear face masks for a long time? Let's have that conversation around kids, schools, what they can do to keep safe.
Okay, great. So for schools, that we know that yes, we are not used to wearing masks. It might be a bit uncomfortable, but when you weigh the benefits of wearing it and not wearing, then you know that you really need to be wearing mask. So for schools, what is recommended is children from 6 years and above are those that should that can withstand wearing the mask. There's also some exemptions for those. who have some medical conditions. We know children 5 years and below will not be able to wear the mask for that long period. But one key thing is about the distancing, and the physical distancing will really help to ensure that they are all spaced within the um, the classrooms, the doors, the windows should be open so that there is fresh air moving in and out. That really reduces that. And when people, I think we should just learn to speak through the mask, and the mask should be worn properly.
I mean, I
Properly.
can even hear you from here with your max on and all.
Yeah, so
Yes.
I'm already used to it. I've been on this for months. Once I leave my house, I'm on this till I get back home,
Wow.
right late in the night. So um, I'm not even looking at the comfort. I've already adapted to it, and I
Mm,
think everyone can also do it because it's a choice to be responsible. I'm not just doing this for myself. I'm doing this for my family too.
mhm,
So it's very important we do this. And as parents, as teachers, we should be role models. We should show the children how to use the mask correctly. It should cover the nose and the mouth. That is the essence. And if someone can speak well, they need to be able to speak louder. Over time, we'll all get how to speak louder with this. And if anyone is feeling a bit choked up, probably within the person can excuse himself, go outside, taking a fresh air, and now come back into the class. So I guess those short breaks are allowed where they
mhm.
move out of the class, they are well spaced in an open space. I think the learning can actually be done outside the class with the COVID period, and also limiting the number of persons that will be in classes. So there's been engagement with the Ministry of Education and partners to ensure that there's adequate spacing within the schools, and also spacing of beds is also important, especially for those who have boarding facilities. I think the time when they should not wear a mask is when they want to sleep. Want to sleep, they take off their mask. But the physical distancing will really help a lot, ensuring that there are several hand washing stations within the school environment. Really helps. And the thing is this, for a school, for a boarding school, if someone has it, uh, from the experiences we've had, we just need to test everyone because you can't really know who who might have been in contact with that person. Then regular cleaning of surfaces is very important. Detergent using 0.05% of chlorine really helps. So this should be done constantly. Hand knobs should be cleaned. So these are the measures to take. We know that our children need to be educated, and we can't be at home forever. The other aspect is also using of technology, the internet, to ensure that learning can still continue even while this is on. So schools should actually look at combining this. The thing with young persons is when they have it, it's usually asymptomatic of very mild symptoms, so they can still continue learning. And so provisions need to be made to ensure that learning continues while we wait for the vaccines to be available. And once vaccines are available, I guess that will really reduce the pressure we have.
Okay. Speaking about vaccines, so we've heard the good news that Pfizer and BioNTech developed a vaccine that is 90% effective for to stop people from getting COVID-19. Now, with this information at our disposal, you said waiting for us to get the vaccine. How long will it take before we will be able to have the vaccine in Nigeria?
Okay, so for us to get there, I think the main thing is that the world is together in this. The World Health Organization is coordinating this aspect. There's a COVAX coalition. We have over 150 countries already signed up to ensure that this vaccine is not just for developed countries, but for all countries, because any disease, any threat, any disease anywhere can get to any part of the world at any point in time. This started from China, and now we have over 216 countries, territories, and areas already having this. So it's about solidarity, coming together, knowing that if things are not going well with your fellow human being, it could actually also come back to you. So. Uh, we all need to get this together, and it's going to take a process. So Pfizer is just one of the candidates. There are other trials also ongoing, which has promise of also have been very efficacious. So once all those the processes are done, the trials, then we'll have a different area of vaccines to be used. And this is a global movement. We all need to get protected. So, but
Yeah.
meanwhile, it might take like a year. I'm not so sure of the time, but
Yeah.
uh, before that, the safety measures which we have in place will really help. Wearing the mask, washing hands, physical distancing. Those are the things we can do. Regular cleaning of surfaces. This is very
Mm-hmm.
important, making our environment tidy. So as we look at all this, we should not just be fixated with COVID. We should know that our environment, not just personal hygiene, environmental hygiene is also very important. Uh, we know we have yellow fever, Lassa fever is there, so we should look
Yeah.
at it as a whole package. So this is not just for COVID, but also for will also help us in other prevent other diseases.
Thank you. Thank you so much, Doctor. Over to you, Mr. Ali. Before you go, what message do you have for Nigerians, especially since the announcement of the vaccine? You know, it has risen the hope of a lot of people, and people are like, okay, that means COVID is over. I can go about my business. What message do you have for Nigerians who believe that the vaccine means announcement of the vaccine is an end to the spread of the infection?
Yeah, my message is that we are actually grateful and we are thankful and happy that there is actually a vaccine and that others are even in trial at the moment. But that does not mean that we should now be complacent as regards the safety guidelines. As
I
the
mean,
Dr.
doctor said that it could take maybe up to 1 year. Like
Yeah,
it's a long
exactly.
time.
I was about to say that. Like the doctor has said, it will take about a year before it even gets to Nigeria. So in that time period, all the safety guidelines need to be adhered to so that we do not get a spike in cases. Regular hand washing, wearing of face masks, social distancing, hand sanitizers if you cannot get running water. All these are very, very important. And it is also important that that the government also intensifies testing too, because as people are being tested, we get to know the true situation of things and know what other measures we need to take before the vaccine comes. So please, as Nigerians, we want to be very proactive as regards trying to prevent ourselves from contracting this virus.
All right, thank you so much, gentlemen. Doctor and doctor. Is it right to say you are a public health practitioner? Are you also a doctor too?
No, I'm not a doctor. Yeah.
All right. Well, it's so good to have you today on the show and doing this with us, answering our questions and all. It has indeed gone a long way in helping Nigerians. I hope you have a fantastic day. Okay, so we've had Dr. Aderiola Olaolu, who is the incident manager of the National COVID-19 Emergency Operations Center (NCDC). Thank you, sir.
Thank you so much.
And also Ale Odiame, are your public health practitioner. Thank you so much.
Thanks for having me.
Okay, my name is Sylvia Ishibe, and I'll be back tomorrow for but that Nigerian thing. But you can also continue listening to us on www.clickniger.net. That is where the conversation goes from here. And our Instagram, we're at Click Niger, and Twitter, Click Niger1. All right. So share this video and continue to pass on the message. Wear your mask, wash your hands, and keep safe. Bye for now. Have a fantastic day, gentlemen and ladies.
Thank you.
Yeah, thank
Bye.
you.